We did an analysis in Brazil looking at how many patients with myeloma could be transplanted in a public health system. And in fact, it's a very important data showing that since we have problems with the number of transplant units in Brazil and beds, we were able to transplant only about 20% of the patients with myeloma in the 6 months after diagnosis, meaning that the best should have about 80 to 90% of those patients being transplanted during the 6 months after diagnosis. However, we were able to transplant only 20% of those patients, meaning that we need more beds and we need more transplant units in Brazil. And this was in the state of Sao Paulo, where we have many transplant units, transplant centers there. So it means that even in regions in Brazil where we do not have transplant centers, it means that many patients with myeloma are not being transplanted, and we know that the bone marrow transplantation is the backbone of treatment for those patients.